through the semicircular canals of the inner ear. These are basically fluid-filled tubes that help us sense movement. These crystals aren't supposed to be there, and when they float freely within the tube, they cause a false sensation of movement or spinning. Now that we know what BPPV is, the top 4 causes might make a little more sense. The number 1 most common cause of BPPV is a blow to the head. This could range from a mild bump to the head or could be more serious, like head trauma. So for some people it happens after a car accident. The sudden jarring of the head causes the calcium carbonate crystals to break free and start to move around inside your inner ear canals. You wouldn't necessarily know it at the time it happened, but vertigo episodes may start to come on after a head injury. Another common cause of BPPV is age. It's more common as people get older, especially after the age of 60. This could be due to degenerative changes to the inner ear that happen naturally as we age, which could make it easier for an inner ear crystal to become dislodged. People with osteoporosis may be at higher risk, and that is more common in older adults, but the relationship between age and BPPV is not entirely clear. It's also important to understand that BPPV occurs in all age groups. The third cause for BPPV is having an ear or dental procedure. It's not super common, but sometimes after surgery on the ear or even just having dental work done, that can cause symptoms to start. Again, these are uncommon causes, but it's rare but possible. The fourth cause for BPPV is a viral infection. This one may actually be pretty common. Viruses can affect the inner ear, causing changes in fluids and pressures and stirring up inflammation, which may cause the inner ear particles to come loose. A study compared close to 500 people who had BPPV with those who didn't. They tested for 8 different kinds of viruses and found that the group with BPPV had higher levels of all but 2 of the viruses they tested for, which shows a strong connection. Some other factors that can be involved in developing BPPV, they may not be causes, but they likely make you more susceptible. So people who suffer from migraines are more likely to get it. Females and diabetics are also more likely to get BPPV. It's not really well understood as to why, but that is what the data shows. You probably can't just stop being female or having migraines, but you can do your best to manage your diabetes if you have it, which would likely help reduce your risk. I hope this video helps improve your understanding of what BPPV is and what causes it. If you want to know how to fix it on your own, check out my video titled Vertigo Cure BPPV Self-Treatment. In it, I'll show you the Carol Foster maneuver that can completely stop the dizziness even after doing it just one time. Some people will have to give it a few tries, but it has helped thousands and thousands of people. Go check it out.